As I mentioned earlier, children overall are vulnerable to environmental hazard exposures, but because but low-income children and children of color are at a much higher risk because communities of color and low-income communities experience inequitable factors such as housing discrimination, historical racism, high rates of poverty, and environmental hazards. And this leads to inequities in health outcomes. For example, according to research from 2017, African-American women were most likely to give birth to a low birth weight infant. Another study indicated that 13% of African-American children had asthma compared with 8% white, 8% of Latinx, and 4% of Asian children. And research from between 2013 and 2016 indicated that Latinx and African-American children were more likely to have obesity than white children. Inequities also exist in exposures due to Black, Brown, and low-income communities being more likely to live near polluting facilities, hazardous waste sites, and in substandard housing. And unfortunately, childcare has always been underfunded. Providers are not paid enough despite childcare being essential for our economy and children's development. And childcare facilities in the United States enroll over 11 million children ages 5 and under, and children and providers spend the majority of their time in these settings, making them one of the most important settings that may affect their health. Minority-owned businesses account for 60% of childcare and early learning, and of the 2 million early childhood educators in the country, at least 1/5 are immigrants. And as of March 2020, Congress enacted billions of dollars in relief through the CARES Act, the Coronavirus Response and Relief Supplemental Appropriations Act, and the American Rescue Plan Act. And in addition to these resources, Congress provided states with stimulus resources to invest in small businesses, and many of them were used to strengthen the health, safety, and supply of childcare facilities. And our Eco-Healthy Childcare Program, EHCC for short, is an award-winning and science-based program of the Children's Environmental Health Network. It is the only national environmental health endorsement program for early care and education providers. And we have been awarded a few awards. For example, in 2019, we were awarded the Clean Air Excellence Award from the United States Environmental Protection Agency, and in 2013, the Environmental Health Innovation Award from the National Environmental Health Association, to name a couple. So our program focuses on protecting children and providers from environmental hazards in childcare facilities. The program endorses facilities that meet 24 out of the 30 best practices, and the endorsement is valid for 2 years, and then it needs to be renewed. We offer free to low cost solutions for those facilities that are in the process of working towards their endorsement. For example, using only cold water when preparing powder formula, selecting fragrance-free products, or placing a rough mat at the entrance of the facility for wiping shoes after playing outside. And our program includes a 5-hour train-the-trainer curriculum for childcare professionals, for example, trainers, childcare licensing staff, nurse, and health consultants, and it has been delivered in 33 states. And this curriculum is scientifically based, peer-reviewed, and covers in detail the environmental hazards commonly found in childcare facilities. We also have an e-learning course that is available through Pro Solutions and Emory's online learning hub. And providers can take this course to also earn adult learning clock hours that has been approved in 48 states. And our Eco-Healthy Childcare Program has endorsed more than 2,000 childcare facilities that serve over 70,000 children. Our program covers a range of environmental health topics, from pest control to radon. And for each of these topics, we have fact sheets available in English and Spanish. And we also have additional topics such as bug repellent and sun safety that are covered within our EHCC FAQ resources. So EHCC aims to uplift the importance of protecting children and the providers. And often the childcare workforce is predominantly made up of Black and Brown women of childbearing age. And this becomes an environmental justice and health equity issue because it places providers at high risk of environmental hazard exposures, which may lead to poor health outcomes. And with the pandemic, there has been an increase in the attention to cleaning and disinfection practices. And unfortunately, many cleaning and disinfection products contain ingredients that are harmful. For example, ammonia, chlorine bleach, which can injure the skin, the eyes, and exacerbate asthma, placing providers and children at high risk for poor health outcomes. And even though safe certified green cleaning and disinfection products exist, they are difficult to access because they are expensive and providers may not have the monetary resources to purchase them. So this results in inequitable access to healthy options, which may exacerbate existing health disparities in Black, Brown, and low-income communities. And in addition to that, many childcare providers are not trained in children's environmental health, and this is often not included in their professional development or state's quality rating systems. And as a response to COVID, the Children's Environmental Health Network has demonstrated its leadership and response to support providers. And with support from the Centers for Disease Control and Prevention, we participated in an early care and education collaborative to decrease COVID in childcare settings. And we created new resources available in English and Spanish that highlighted safer and healthier cleaning, disinfecting, and ventilation to reduce exposures in childcare facilities. And we also met with state departments of health who are also working on developing childcare resources, and we provided webinars that had more than 4,000 registrants. And an example of our collaboration is with our partner, All Our Kin. They are a nationally recognized nonprofit with offices in New York City and Connecticut. All Our Kin supports family childcare educators in underserved communities. And at the moment, they're in the process of developing an outdoor education program focused on the built environment. And we provided support with our resources and webinars for educators in starting to use the built environment as an opportunity to begin introducing childcare educators to environmental health and begin building rapport with them. So thank you again for joining us. And if you would like to connect or have any questions, please feel free to send us an email or connect through our social media. Thank you.
Thank you, Roxana. If there are questions, I just want to remind folks, feel free to drop questions in the chat. We will do kind of a group question session at the end. But right now, we will go straight into our next presentation by Darya Minovi.
All right, give me 1 second. Okay. Are y'all seeing my PowerPoint?
Yep.
Yes.
Awesome. Okay, great. Well, thank you so much for having me. My name is Darya Minovi. I'm a policy analyst at the Center for Progressive Reform, and I'm here today to talk about how me and folks at my organization and a group of advocates in Maryland are using research and community science to assess nitrates and ultimately protect drinking water in the state of Maryland. Before I dive in, I wanted to share a little background on CPR as an organization. Through legal and policy research and advocacy, the Center for Progressive Reform works to advance policies and processes that ensure the safety, health, and well-being of people, their communities, and our environment. We operate with a member scholar network of about 60 environmental and administrative law professors from around the country to contribute to our research. And our major focus areas are on the issues of workers' rights, public health, environment, climate resilience, and good government. Much of our work focuses on the national or federal level, but our place-based work specifically is primarily focused in the Chesapeake Bay region. where many of us here are focused. So one of our Bay projects is a collaborative effort between several regional research and advocacy organizations, as well as grassroots advocates that are working to assess and address the impacts of industrial agriculture on the lower eastern shore of Maryland. As some folks here likely know, Maryland's lower shore is where the majority of the state's poultry concentrated animal feeding operations, or CAFOs, are located. You can see here on the slide, for example, this is an aerial image of Pocomoke City on the lower shore, and the yellow circles around all of the chicken houses in that region. So just to illustrate the density of these facilities. And while CAFOs are, or while poultry operations are, important to the region's heritage and the economy, these chickens produce an immense amount of nutrient-rich litter, which can pollute both our air and our waterways. And while there are some programs and regulations that restrict how much of this manure can then be applied to fields, these policies do not go far enough, and the number of CAFOs has also skyrocketed in this region over the last decade in particular. For example, we did an estimate that calculated an estimate that there are about 240 chickens per resident of the lower shore, just to give you a sense of how many there are. And over the last decade, advocates and activists have become increasingly concerned about the impacts of these operations to public health and the Chesapeake Bay. Oh, sorry, don't know why that was there. So one pollutant that community advocates are specifically concerned about is nitrate. Nitrates are an odorless, colorless, and tasteless compound that can enter groundwater when excess amounts of manure or fertilizer are applied to fields, or if a septic system fails. Agriculture is the primary source of nitrogen into waterways on the eastern shore. And as you can imagine, nitrates are relatively prevalent in groundwater in agricultural areas. Our partners, who were, grassroots advocates, community organizations in the region, they were aware of nitrates. They knew what they were. They knew that Delaware had some, issues. Folks in Delaware were having issues with nitrate, but no one really knew the extent of contamination that there may be in the lower shore region, and specifically the drinking water on the lower shore. So to provide a little more background on nitrate as a drinking water contaminant, it's well established that nitrate ingestion can cause methemoglobinemia, also known by the horrifying name of blue baby syndrome, which is a condition that can be fatal to infants under 6 months of age. The EPA's maximum contaminant level or drinking water threshold for nitrate is intended to prevent cases of blue baby syndrome and was set at a level of 10 milligrams per liter in 1991 because of a 1950s study, which I have a screenshot of up there if anyone wants to read it. And this study found 278 cases of blue baby syndrome at nitrate concentrations above that threshold. That being said, we've learned a lot in those 70 years since this initial study, especially regarding the long-term health effects of nitrate consumption. More recent research has found an association between nitrate in drinking water and cancer, especially colorectal cancer, pregnancy complications, birth defects, and possibly thyroid disease. Other studies have also found cases of blue baby syndrome and elevated levels of methemoglobin in pregnant women at levels well below that MCL. I didn't quite come across a definitive recommendation for what a more protective MCL should be, but based on my research, I think something like 3 to 5 milligrams per liter would be more appropriate based on what we know now. But a risk assessment is certainly necessary to determine that. The reason why this is concerning is that EPA standard, which largely applies to public water systems, is first off, likely not strong enough. And on top of that, many folks on the lower shore rely on private wells for their drinking water. Private wells are not regulated under the Federal Safe Drinking Water Act, meaning that there's no requirement to test well water quality regularly or ensure that it's safe to consume on an ongoing basis. And as a result, well owners are pretty much responsible for their own drinking water. You're in charge of testing it. If anything happens to that well, you're in charge of paying for the cost of cleaning it up. So this prompted us to look into this question which culminated in a report released nearly a year ago called Tainted Tap. I can share that in the chat afterward if anyone wants to read it. But in our report, we examined nitrate concentrations in drinking water on Maryland's Lower Eastern Shore and assessed policies that states nationwide have adopted to protect private well owners. In Maryland, private wells used for drinking water are required to be tested one time, and that is when they're drilled. So through Public Information Act requests, I was able to collect these water quality results for 3 lower shore counties, that's Wicomico, Worcester, and Somerset. The quality of the data varied based on what was available, but I was able to get records for at least 100 wells in each county. And our analysis showed that in Wicomico and Worcester counties, roughly 1 out of every 14 wells tested since 1965 had nitrate levels above 10 milligrams per liter, which once again is EPA's threshold. However, when you use that more protective limit of 3 milligrams per liter, we found that 1 in 10 or 10% of wells in those 2 counties exceeded that level. Here on this map, you can see the locations of these wells. The wells that are between 3 to 10 milligrams per liter are light pink, and the wells above 10 milligrams per liter are red. As I just mentioned, the quality of the data is a limitation to this assessment. For example, in Worcester County, which you can see on the right side of the map, they provide us with a very comprehensive Excel database of their well water quality results, which they've maintained through the years, whereas in Wicomico and Somerset, they only were able to give us paper records. Many of them you couldn't even read. And so we only were able to get scans for about 100 wells each, and they were randomly selected from what they could find. As you can see in Somerset County as well, from the records we received, nitrates were not detected. So while this map is a helpful visual, certainly take it with a grain of salt. It also shows us what nitrate levels were at the time the well was drilled. And because record keeping is pretty inconsistent, we don't really know whether these wells are still in operation or not. On top of that, the USGS data on nitrate in groundwater suggests that concentrations can increase and will likely increase over time as water moves through groundwater or to lower aquifers, deeper aquifers. And so the current picture of contamination could look very different from what we're seeing on this map. We also looked at the consumer confidence reports for public utilities in the region. These are updated each year with the testing results for all regulated contaminants. They're publicly available. You can find one if you have public water, you can find one online for your county or your utility. And of the 13 utilities that reported nitrate levels at least once between 2018 and 2020, 8 had nitrate concentrations exceeding 3 milligrams per liter. All of these were in Wicomico and Worcester counties, and one of those exceeded EPA's threshold of 10 milligrams per liter. While our study did not assess the link between nitrate exposure and health outcomes in the region, what is clear is that there are health disparities between the state and the lower shore, and in the least, prolonged nitrate exposure could be widening these gaps. Lower Eastern Shore counties have long had some of the highest rates of cancer mortality and infant mortality in the state. A study published this year also found that lower shore residents with cancer, particularly colon cancer, which as I mentioned is associated with nitrate exposure, were more likely to rely on well water than public water. This also feeds into a larger question about how and where concentration animal feeding operations are sited in the United States. Research done by some of the experts participating in this conference have shown that CAFOs are often disproportionately located in Black and lower wealth communities, and of the 9 Eastern Shore counties, Somerset and Wicomico have the highest proportion of Black residents in the region, and so race and class inequities certainly cannot be viewed. These issues all have to be viewed together as it's part and parcel of the same issue. Our assessment also looked at key policies and programs that states have adopted to safeguard private well owners. As you can see on this list, this includes things like providing well owners with a free testing kit to test their well water, requiring a property seller to disclose their well testing result to a buyer, maintaining a public database of well records. These are just basic programs that states have adopted. And we found, after doing a national analysis, that in Maryland, outside of that initial water quality test when a well is first drilled, there are no additional policies or programs to protect private wells. The State Department of Environment used to operate a groundwater protection program where it monitored and reported on the state's groundwater resources, but they haven't reported on that program since 2013. And even more concerning, that 2013 report stated, quote, due to agricultural land use practices, nitrate concentrations in shallow aquifers on Maryland's eastern shore commonly exceed the federal drinking water standard. And so outside of that initial test and some minor education on private wells, there really isn't much happening in Maryland. This map illustrates those findings. Maryland actually ranked among the 5 states with the fewest well water protections nationwide, alongside Pennsylvania, West Virginia, Georgia, and Alaska. And some of these gaps contribute to why our grassroots partners knew so little about nitrates in their drinking water. Without a public database of well records, without funding to assist with the cost of testing wells or cleaning up contaminated wells like there are in Iowa and Wisconsin, without a groundwater protection program, community members are largely left in the dark about the quality of their drinking water. So while our report uncovered a lot of important information about drinking water nitrate in the region, it also revealed how much we don't know, including what well water quality looks like at present and what the broader community's understanding of nitrate is. So following the release of our report, we conducted a poll of 400 Lower Eastern Shore residents in November of last year. The poll showed that about 65% of respondents knew nothing or a little about nitrates in drinking water. Even more, roughly 3/4 of respondents who are well owners stated that they had either never tested the quality of their well water or had done so more than a year ago, and the general recommendation is to test annually. The most common reason given for not testing was, quote, I didn't know I needed to. We also observed an inverse relationship between well testing frequency and household income. These results confirmed what we'd suspected, which is that well owners in the region are largely unaware of the quality of their drinking water, and lack of information and resources appears to be a significant barrier to doing so. And so we decided to eliminate some of those barriers and partnered with researchers at the University of Maryland School of Public Health to launch a community science initiative. So we joined with Rhianna Murray at UMD, as well as fellow members of our broader collaborative working on the Lower Eastern Shore. It's the Acetate Coastal Trust and the Environmental Integrity Project, and we launched the Lower Shore Safe Well Water Initiative in April of this year. The goals of this project were to understand the current extent of nitrate contamination in wells on the Lower Eastern Shore, to engage residents in community science and also in the process of safeguarding their drinking water, to raise awareness about the public health risks of nitrate in drinking water, and also about strategies that well owners can take to mitigate these risks. Through this initiative, well owners in those 3 lower shore counties can sign up to receive a free testing kit for nitrate. Participants were then mailed a kit with instructional brochure, and then they were either able to mail back or just take a photo and email their results to us. To be able to test as many wells as possible, we use test strips, which are not the gold standard like a lab test is, but this helped us do initial screening and provide tests to more people. And then for any wells with 5 or more milligrams per liter of nitrate, that's half of the EPA's MCL, we also offered free confirmation testing through a lab. While this initiative is ongoing, so far we've gotten results back from around 110 lower shore residents. From the wells tested, roughly 17% had nitrate levels of 5 milligrams per liter or above, and 6 of the tests were above 10 milligrams per liter, which is exceeding EPA's threshold. We contacted all of the participants with their results, interpreted the results for them, and then provided information and resources for folks who had a contaminated well. And thankfully for all of the folks that we spoke with, they now have reverse osmosis systems in place in their households, thank goodness. And that's really important because one thing, again, with nitrates being odorless, colorless, tasteless, you don't really know it's there. And they also can't be removed through chemical disinfection or boiling or just standard filters. So you unfortunately need those costlier RO systems to remove them. We also hosted a free webinar training last month for all of the participants that focused on, it was a training on well safety and management so that folks have the tools and information to continue to safeguard their wells going forward. On the slide, you can see a map of where these wells are located. Oh, sorry about that. Okay, I'll just keep going. So on the slide, you can see a map of where these wells are located. There seem to be some, hotspots around Salisbury, as well as on the eastern end by Ocean Pines. So where do we go from here? The Lower Shore Safe Well Water Initiative, as I mentioned, is still enrolling participants for another month or two. So we would, of course, love to get more folks involved. So help us spread the word. We have a great network of grassroots organizations on the Lower Shore that helped us, put the word out there. But if you, live on the Lower Shore and have a well, know folks out there, you are welcome to share our website link with them so they can sign up. And once all the data is compiled, I'll be doing some additional analysis and then hope to share our findings with the state and local agencies that oversee well water resources on the Lower Shore. Alongside this ongoing research, members of our collaborative have also been advocating on this issue. Following the release of our Tainted Tap report, there was some interest from legislators that would create in this issue, and we worked with Delegate Stewart to introduce a bill that would create a well safety program in Maryland, essentially addressing all of those gaps that I mentioned earlier. So it would have provided funding for testing, for well remediation, create a public database, include disclosure requirements of well testing results. Unfortunately, the bill ran into some opposition due to concerns around funding. So it was ultimately stripped down to a bill that just requires landlords to test their wells every 3 years to clean up contaminated well water and disclose that information to tenants. Is mind-blowing that that wasn't a requirement already in the state, since it's pretty standard in other states. But that bill did pass and will go into effect on October 1st. So if you are a tenant or a landlord and have well water, be aware. And that bill number is House Bill 1069. That being said, there was a lot of interest among legislators in this issue. There were several calls from them, like, come back to us next year with a more comprehensive bill. And so we are actually now working on preparing for the 2022 session. And so Delegate Stewart has actually convened a work group of stakeholders, including well and septics experts, state and local government staff from affected counties, and other advocates to help resolve those outstanding concerns, with the hope that we can propose a more comprehensive bill again in 2022, have those funding concerns addressed. And my hope is that the data that we collected through the Lower Shore Safe Well Water Initiative will also be a helpful piece of information to continue making the case for this, especially because an issue of the lack of any public database or records came up over and over again in the legislative session. And another hope is that that we can engage the folks who participated in this community science initiative when the time comes, if they've been impacted by this at all, that hopefully they'll be supportive of this legislation as well. So a very multifaceted program that includes bits of research and advocacy, community engagement. So I think that's it for me, but I'm happy to take any questions, and I'll put some information in the chat, and there's my email if you'd like to get in touch. Thanks.
Thank you, Darya. I am seeing some questions popping up on Whova, and we'll be answering kind of as a panel. We'll do questions across the board once we get to the end of our final session, which is coming up now from Elizabeth Spike. Elizabeth, I've made you a co-host, so you should be able to share your screen. There it is.
Okay, can you hear me?
Yes, we can hear you now.
Okay,
Thanks.
thank you. Thank you. Great, and you can see me. Okay, so thank you for inviting me to share today. My name is Elizabeth Spike. I'm an alternative school teacher of science in the AIM program in Fairfax County Public Schools in Northern Virginia. And I want to say right off the bat that the views that I present in my talk today are my own. They belong to me and not my employer. So today I'm going to talk about reimagining the future of science education for all students. I'm going to specifically talk about environmental justice teaching in the science classroom. 1 second here. There we go. Okay, so my environmental justice work started in an urban high school in Rochester, New York in the early 2000s. I assigned my students to make a poster report on a community facing environmental racism. And the general feedback from students was positive, and it made science class a little bit more interesting and relevant. For myself as a kid growing up in Rochester, New York, about 90 miles away from Love Canal, this assignment actually taught me about the Love Canal struggle, helping launch the Superfund Act. So I don't know why I was never taught Love Canal as part of science class or social studies class, but I can only imagine how many other stories like Warren County, North Carolina go unheard, and the lost learning potential about how science affects us all. In Houston, Texas, my students and I applied Dr. Bullard's work on landfill siting in African-American neighborhoods, and we tested All Lives Matter. Students were definitely intrigued by the challenge of whether everybody in Houston enjoyed environmental protections. So to answer this question, we read The Mountains of Houston by Dr. Bullard. We reviewed landfill and demographic data from then and now. We designed and tested a mock landfill liner for water holding capacity. And students role played city council members representing constituents from 4 different districts, A, B, C, D, as you can see in the picture. This all culminated in the students working together as a group to demonstrate where they would put the landfill, but they had to demonstrate how environmental justice would guide their group decision-making. What we discovered was there were no landfills in the zip codes of our school or where my affluent students generally lived. Instead, most of the landfills were located on the east and south sides of town where people of color historically resided. We concluded All Lives Matter failed the test of equal environmental protections. More recently, I became an EE 360 Community Fellow with North American Association for Environmental Ed. My primary partner was and continues to be Breed DC. They're a community health-based organization. They focus on health disparities in Ward 6, 7, and 8. I also partnered with the Baltimore, Washington chapter of the Air and Waste Management Association, and that's a professional society for environmental engineers. Together with their support, I organized an air monitoring project called Our Air, Your Future, Creating Clean Air Advocates. The Google map shows where the PM 2.5 and ozone sensors are located across the DMV. So I recruited high school teachers to collect air quality samples quarterly and to share their data between urban and suburban schools. We planned on student presentations to community leaders at the annual Student Environmental Action Showcase in April 2020, but COVID put that on hold. And I'm a little concerned about the rising cases of Delta and a potential for remote teaching again, which means that this project continues to be on hold. I'd like to offer some reflections on teaching environmental justice in science classrooms. And I'd like to start with state science standards. In my experience, I've taught in 4 states. I've taught in public and private, urban and suburban school districts. And 3 out of 4 states that I've taught in, Florida, Texas, and Virginia, I have tried to study the standards as best as I can. And what I've learned is that there's a very strong focus on basic science with very limited applied or practical science. Now, there are standards called Next Generation Science Standards, and they have disrupted this conventional prescriptive format for basic science standards, and it's on the right path. But not all states have adopted next-gen science standards. In fact, regardless of where you live, I'd like to see a stronger influence of ethics and public health topics in science standards. And I'd like to see them explicitly stated in standards for two reasons. One, there are preventable public harms that high school science education can address, making students aware of toxic air emissions, infectious disease, climate change, and even gun violence. And secondly, if those standards are explicitly stated, ethics and public health and so on, air quality, if they're explicitly stated, then teachers may pay attention. They may notice them and teach to them. Otherwise, there are some teachers who just adopt an attitude of, if it ain't broke, don't fix it, because there's a lot of prep time involved in teaching. But not everybody shares that broke attitude. And if we want to increase the chances of environmental justice being taught in science classrooms, then we need to develop drop-in lessons or activities that need little modification to minimize that prep time. Environmental justice teaching tells the truth. It leaves no one out and shows how science is relevant. It supports the 4 C's of 21st century skills: collaboration, communication, creativity, and critical thinking. But as you can see on my screen, truth-telling is under attack again. And this time the scapegoat is critical race theory. According to the Brookings Institution, as of late July, the idea of exploring how race-based systems have led to disparities has been banned or barred in 12 states, with 20 more states planning to ban or they're going to introduce legislation. This is censorship, and the focus is social studies teachers. But there's no reason to assume that science will be protected from bad laws. Science has been attacked for teaching evolution, sex ed, climate change. No matter what class students are in, they want to know the truth about the world they live in, and they want to be prepared to participate in society. So who writes the standards and whose vision are we teaching? Certainly not the vision of students in Rhode Island who sued the Rhode Island Department of Education for failing to provide a civics education. They brought their case in 2018. The case was dismissed in 2019, and they are going to appeal the decision. If we default to authority and experts in science education, we have to ask who's at the table writing the standards, or more importantly, who's not at the table. This starts with the writers, and curriculum is approved by state boards of education, and content can end up on state end of course tests. Schools and teachers are evaluated on student outcomes like test scores. So naturally, everybody feels under pressure to teach to the test. So this limits the chance that environmental justice teaching goes on in the classroom. But my warning is, beware, kids are onto us. We're supposed to show how to be productive participants in society, but our children learn very quickly that adults can be hypocrites about truth-telling. They watch us cleverly evade and avoid controversy. They see us securing justice for some groups, but not necessarily all. And that we take the path of least resistance and blame the victim instead of fixing the system. So how can students influence policy? So I believe it starts with awareness. It can start in the classroom. It can start with the basic teaching of science, laws, and ethics applied to the issue of concern. And then students need to be given opportunities to skill build. They need opportunities to communicate and collaborate together in a group setting, so that the next level would be public engagement, so that they have an opportunity to speak to the public about issues that they care very much about. So for example, I organize a young adult sustainability night where teens and college students could come and talk about environmental issues with a focus on solutions. Another opportunity is the Student Environmental Action Showcase that happens every year at George Mason University. This is a K through 12 event. And students are invited to come and talk about the issues that they care very much about with a focus on solutions. The last slide, I've got just a few more slides, but I'd like to share some tips and suggestions for anybody trying to teach environmental justice. You can be in the classroom or you can be in informal education. If you're in the classroom, then definitely know your state standards as best as you can. Look for opportunities where you can inject environmental justice. Definitely know what the limitations are. I'm not a lawyer, and I don't think that every teacher needs a lawyer to try to interpret these silly laws, like in Texas, what you can and cannot say. Nobody knows for sure. It's unclear, and it's just bullying and intimidation, in my opinion, and it puts children in the middle, and that's very unfortunate. So know your standards. Start early. Don't tack on environmental justice at the end of the year in case you have time. If you have a textbook and ethics or environmental justice are presented and they happen to be at the end of the book, like I have seen chapter 20 out of 20 chapters, use your better judgment and front load it, present it first. Next is ethics. Ethics is your guide. It will test assumptions about what is right and wrong. It uses science, it uses reasoning. So you can default to ethics, make ethical decisions about your environmental justice teaching. Local data and testimonies are really important to support environmental justice arguments to protect marginalized communities. Testimonies allow people to speak for themselves about the environmental injustices that they are experiencing, and local data makes it so much more meaningful and relevant so that students can act locally. Learning styles. So you want to engage as many different students as possible. Instead of a worksheet, mix it up. I used essay, video, mapping, engineer, design, role playing, and presentation. It's more interesting, and you're bound to find a learning style that makes everybody happy somewhere along the way. And that leads me to decision making. Decision making is really important. When students are allowed to express themselves about environmental justice in a group, they are given an opportunity to take a stand and present the reasoning. This can be scary, so this is why this plays out in the classroom where we get to practice. Online resources, I have some favorites. I really like Teaching Tolerance. I like Statistics for Action. I like ejnet.org. Anything from Robert Bullard's website and data sets and maps can be super helpful when trying to explain where the environmental justices are located. And finally, norms. It's important to have a respectful and constructive classroom. So you need to devise a set of norms or aspirations or guides. And here are the norms that I have set in my classroom. They're modeled after the James principle of democratic organizing, so that students, everybody feels included and can be a leader and cooperate and respect and speak for themselves, and so on and so forth. And so with that, I thank you.
Thank you, Elizabeth. I'm really happy to have had these three presentations, and even like not just to have them at the show, but have them back to back, because it really kind of sets up for me this picture of work that's not only being in the area, but work that could be collaborative. I don't think before this panel any of you three knew each other, but I can see the interconnections within the work that you're doing. And so I definitely want to open it up for audience Q&A. And I think, let's see, and Zarif, my friendly aide here, has been collecting some of the questions from Huva and sharing them with me here. One thing that occurred to me that I'll just throw in off the top, both Darya and Roxana, you mentioned or invoked kind of this issue that children's health is being impacted by these different areas. Roxana in the workplaces here on the Western Shore, and Darya, the nitrate contamination on the Eastern Shore. Is there an opportunity, I guess this is an opportunity for Roxana maybe to there are surely childcare facilities on the Eastern Shore that may have an interaction with these contaminated nitrate areas. Is there an opportunity for collaboration there?
That's a good idea. While Darya was presenting, I was thinking about that because some childcare facilities are they may be close to these locations where there's like environmental hazards. So I think there could be some collaboration or just sharing any additional information or resources.
Cool. That's just something that lit up in my brain. So going to the Q&A here. So in light of environmental degradation and the rising water levels that are there any plans under development for moving residents from the Eastern Shore to higher ground? This is a question that came up during your presentation, Darya.
Thanks. Yeah, I don't feel equipped to answer that. I don't live on the Eastern Shore, and I feel like that decision rests with the folks who live there, because relocation and climate migration is, I think, a decision that needs to be made in an individual level, at a household community level. So I'm not sure. I have heard, I'm very aware of the issues around flooding and saltwater intrusion in the community. So I'm sure those conversations are happening. I'm not part of them though. So if anyone in the audience has an answer, or other speakers, I encourage you to chime in.
I don't have an answer. It's not my area of expertise, but when we're talking about emergency management, the climate crisis is very much an acute emergency, and especially so on the Eastern Shore. The conversation of buyouts does come into play, and buyouts and a domain and all these different kind of programs enter the discussion. And it's important to note that these programs need to be holistic in their nature and not just provide one-time compensation or monetary compensation, but have to kind of go through the whole gamut of okay, you're buying out people from these homes, but then where are you providing resources and access for them to thrive elsewhere? And I think this kind of goes in line, Elizabeth, with what you were talking about with when we're teaching our students to kind of think holistically, at the whole picture, the whole program that's going on. I'm wondering did you run into, through your program, did you run into any resistance from parents or kickback from fellow teachers or administration as you implement, this environmental justice lens to the work that you're doing?
So I used to teach AP Environmental Science, and environmental justice is a learning objective. So if I ran into interference, I'm not aware of it. It didn't slow us down. No, not at all. I know many parents like to be heavily involved in their students' education, but either I was lucky and I worked with enlightened parents, or they trusted me. I don't know. No issues, none.
That's great to hear. Another question that came in from the audience on Q&A: are there any ocean protectors and fishing industry interested in collaborating on the nitrate pollution solutions?
I have not encountered any. If they would like, I would love to work with as many folks as possible. We have a lot of folks in sort of the river protection, bay protection world involved, but I haven't really interacted with those in the fishing industry. But I think, because I see their interest in this might stem from the impacts that excess nitrogen and nutrient pollution has on oceans and the resources that they rely on for their livelihoods. So there's connections across all levels of where this starts all the way to where it ends, and who it impacts along the way. So open to all collaborations.
So This is a question that I think was a holdover from a previous session, but is still very relevant here, and that is best practices or maybe some targets that you've made when you're advocating for these issues at legislative levels, and that could be at local government, state, a federal level. So, can any of you speak to taking your work beyond the? I mean, I'm sure Darya can go into this maybe at like. But taking this to legislators to get the policy going.
I'm happy to start, and then if others want to jump in. Yeah, I think some important things that we noted when bringing this forth was going into conversations assuming that the person you're talking to has no idea what you're talking about or hasn't heard of this topic anymore or ever. So like, you can't go in talking about nitrate assuming someone understands what that is, why it's concerning. And then a practice that I usually employ as someone with a background in public health is that I find health to be a really strong motivator for environmental action, because there's always, that human environment connection is so important. And, while this issue does have a lot to do with pollution from poultry CAFOs, and something needs to be done about the amount of unmitigated pollution that we're seeing from these operations. We really led from the public health perspective, and like, this is what this could be doing and seems to be doing to people's health and your constituents. And I think that message was really important and effective when we were advocating for this issue.
Thanks.
I'll add a little bit to that. So the policy aspect is very critical for the work that we do, and we do try to advocate like for those policies that really place children at the center. And also like some of the challenges that we face with the work that we do is bringing in the environmental health aspect into childcare. That seems to be like a really big challenge because providers already have to do so much, to get their license, their professional development requirements. And sometimes it feels like bringing the environmental health aspect to it might be still just one more thing on their list to complete. But at the same time, it's still very important because the built environment does affect children's and the provider's health as well. Like, so, for example, when it comes to like building materials or like the type of carpet that you should select, so these things are not like off-gassing and potentially affecting children's health later on.
Awesome. Thanks, Roxana. Elizabeth, any with regards to educational policy, and I was really struck by the tweet that you brought up saying, the other words, the secret code words for critical race theory, and one of those words was identity, and like we don't want kids to know about their identity anymore. Is there anything that strikes you? I don't know if you're specifically in the policy realm, but if there's anything that strikes you as kind of best practices for advancing environmental justice in education through policy.
Yeah, no, I understand. No, I'm not in education policy, and but like I said, I every state I've worked in, I've tried to understand my state standards as best as I can. I see a lot of problems with a lot of state standards. Maybe I should, step up and apply for some of those jobs and try to fix from within, because I think education and we're seeing right now with the mask mandates or the lack thereof in these states with the rise of Delta and the rise in childhood cases of COVID-19, that, children are a political football, and that is unconscionable. So we are not respecting children for who they are. Maybe children would like to wear masks and maybe their parents don't want them to, but children should be allowed to make more decisions for themselves and be respected for that. And if they want to get a COVID vaccine, they should be allowed to do so too. That's a little off topic from environmental justice. That could be a health justice issue as well. But best practices, again, know your standards, build trust, be a good steward or advocate for your students, Maybe perhaps I didn't encounter much pushback because the tone I set in the classroom, the norms are really important. You want to get that out front. And if you use ethics early, if you talk about environmental justice early, you kind of set a pathway. It's not unexpected, it's not unpredictable. It's within, seems normalized.
Thanks for that. Another question from the chat, and this came in during your presentation, Elizabeth. What's being done to stop exposing children to the high heat and toxins from artificial plastics, turf, and tire rubber playgrounds? I'm not sure if you have any expertise there, but or anyone for this question for anyone.
I'll just quick say that the campus that I teach at has turf, artificial turf out on its soccer field. As far as I can tell, not much.
Not much is being done. Go ahead.
I just wanted to add that we do have information on artificial turf, if anyone is interested, in our website.
Awesome, and that's the Children's Environmental Health Network.
Yeah, I can add it to the chat.
Excellent. In our last set of sessions, the urban heat island effect session, the question did come up, and one of the panelists noted that the material itself does get very hot, and in terms of an environmental contributor to heat, there's a little bit of controversy whether is it helping, is it hurting, but you just said from a physical, skin on contact kind of thing, it does get hotter than grass would. But thanks for sharing that information, Roxana. One thing that, and Zarif, let me know if there's anything else. I think we've gotten through all of the audience submitted questions, but one thing that I would like to touch on is the impact that the whole concept of essential workers affects the work that you all are doing. And when we're talking about childcare workers, Roxana, by and large, mostly women of color, and when we're talking about CAFOs and nitrate exposure, nutrient or contamination, nutrient loading in the environment, we're talking about workers of color, farm workers of color, factory workers of color, and even going down to when I'm a little bit of an abstract, Elizabeth, but because I know that a lot of schools kind of handled it differently in terms of teaching and kids going back to school, but accessory or auxiliary workers at the schools, kind of come from often environmental justice communities. So I think in this COVID era that we are still living through, has that impacted the work, or has that added any lenses or added or taken anything away from the work that you all are doing?
I think in terms of childcare and like the providers and the access to cleaning and disinfection and ventilation best practices, it definitely has placed a much higher highlight on those areas, I think, compared to before. And also just thinking that some childcare facilities may be in low income communities. There's not a lot of access or resources to what they need to be able to continue being open, especially during COVID, which is very essential to working parents and families.
Thanks.
On my end, yes, definitely. Environmental justice. I was about to teach that lesson in my current program, and everything shut down. And then air quality is just not even, within the realm of this is a topic we must prepare our students for. It's not explicitly stated in the standard stratospheric ozone is, but not the tropospheric ozone that we're exposed to. So with all the uncertainty of shutting down and switching to remote learning and then hybrid and concurrent schedules, it's been almost impossible to even teach the streamlined curriculum. And students are still held to SOL tests in the state of Virginia.
Darya, have you tracked, or has CPR tracked any impacts from COVID on the work that you're doing?
You know, yeah, it wasn't, I don't think it, I had two thoughts about that. And, you know, in terms of, first is when we're trying to collect our data, I guess from a research perspective, it was really hard because I couldn't go in person to get a lot of the records. And so we might have been able to access, you know, stronger data if we could have gone in person. And then, you know, the frequency with which people are testing their well water might have gone down because of COVID, because people are trying to avoid interactions or, you know, aren't prioritizing those things. It could go, I guess, the either other way as well, but that I did have a thought about that with our polling of maybe it was less frequent because of the impact of COVID.
Interesting. Well, we've got 4 minutes left on the clock. We could, let's see, I'm looking, switching over to Hoover. Zarif, do we have any other questions that have come in?
No, so we've gone through the ones from the Hoover and from chat. So I think we're good on that front.
Killing it. All right. Well, so Roxana shared a link to her website or to her organization's website. I think other panelists, you are registered on Hoover, so folks can reach out to you and send messages to you. Feel free to drop any, you know, email contacts, Twitter, social media, how to get in touch and stay in touch with you all. Thank you very much for joining us today. The next session, well, so we're out of concurrent sessions now. We're all going back to the plenary on advancing justice, equity, diversity, and inclusion. I usually use DEIJ, but Dr. Wilson really likes JEDI. He's a nerd like that. So I have to flip it in my brain: justice, equity, diversity, inclusion. So advancing JEDI in the environmental advocacy space is the next plenary session. And that'll be back in the main Zoom webinar that we started off in this morning. So that'll kick off at 3:40. So 13-minute break now before going into that session. In the meantime, feel free, please explore Hoover. We're paying for it. So make the most of it, make some connections. It's the virtual world, the virtual conference world is tough and less exciting than the in-person conference world, but please, you know, make the most of the platform while you can. All right. Well, thank you, everyone. Take care.